So how do you pee once you've produced urine? So the ureters actively convey urine from the kidneys to the bladder. They are retroperitoneal, so they're behind the peritoneum, and they enter the bladder at the bottom of the bladder through the posterior wall, which is kind of funny. But so what that happens is, as the bladder increases, the ureters get cut off. So as the bladder fills, the ureters close, and that prevents the backflow of urine up into the kidneys. Ureters have three basic layers. They've got transitional epithelium. They've got this epithelial layer that's made up of a transitional epithelium. They've got a smooth muscle layer, and that's right here, and that's involved in the peristalsis, and it contracts in response to stretch. So when the ureter gets filled with urine, it contracts. And then there's the adventitia right here, or outer fibrous layer of connective tissue. Okay, so let's talk about a homeostatic imbalance. Renal calculi, these are kidney stones. It's another word for kidney stones that can form in the renal pelvis. They can be formed from crystallized salts such as calcium, magnesium, or uric acid. And the larger stones can block the ureter, cause pressure and lots of pain in the kidneys. Some of the reasons that may cause them are chronic bacterial infections, holding your pee for too much, urine retention, too much calcium in your blood, and a high pH of your urine. Okay, so let's talk a little bit about the bladder. So the urinary bladder is a muscular sac that can expand as urine is produced by the kidneys, and it allows the storage of urine until voiding is convenient. So we've got three layers: an outer adventitia, a middle layer of detrusor muscle, so this is a strong muscle here, and then an inner mucosa with lots of folds called rugae. And this highly folded mucosa can allow distension of the bladder or expansion of the bladder without a large increase in internal pressure. The urethra is a muscular tube that drains urine from the body. It is 3 to 4 centimeters long in females, but closer to 20 centimeters in males. In females, it just carries urine. In males, it carries both semen and urine. There are two sphincters associated with their urethra: the internal urethral sphincter, this region right here, where the ureters enter the bladder, and this triangle right here is called the trigone, and the internal urethral sphincter. Excuse me. And then the external urethral sphincter is voluntary muscle and formed by the skeletal muscle at the urogenital diaphragm. The internal urethral sphincter is involuntary and formed from the detrusor muscle. And then the orifice here, the external urethral orifice, lies between the clitoris and vaginal opening in females, and at the tip of the penis in males. So males have a couple differences from females. You didn't know that, huh? So there's the prostate here is right under the internal urethral sphincter, and it actually goes around the urethra, and that there's several different layers, several different regions of the urethra. There's the prostatic urethra, where it goes through the prostate. That's why in old men can't empty their bladder sometimes, and they have to go, feel like they have to go lots and lots and lots, because the prostate gets enlarged as you get older and squeezes off the urethra here. And then we've got the membranous urethra, and then down here we've got the spongy urethra as it passes through the erectile tissue. So micturition is a fancy word for peeing, pissing, making water, tinkling, whatever you would like to call it, urination or voiding. So what happens? Contraction of the detrusor muscle by the autonomic nervous system, involuntary. Opening of the internal urethral sphincter by the autonomic nervous system, again involuntary. And then opening of the external urethral sphincter by the somatic nervous system. So voluntary, so as the urine accumulates, distension of the bladder activates stretch receptors, which trigger the spinal receptors, resulting in the release of this urine. So voluntary initiation of voiding reflexes results in activation of the Micturition centers of the pons, so in the brainstem, and this signals parasympathetic motor neurons that stimulate the contraction of the detrusor muscle and the relaxation of the urinary sphincters. So we gain much more control of these processes as we age, as we get older, because obviously infants don't have voluntary control of micturition. Okay, that's it for chapter 25. If you have any questions, let me know. I hope this was of use to you.